Good day, Facebook. Um, Today we're happy to have Dr. Karen Lewis with us again for part two of our live, and we'll be talking about Alzheimer's. And if you missed it last week, please go back and join and watch it because it was very informative. And today we're going to be doing part two. Today's quote is being healthy is a success that many people forget to celebrate. Let that sink in for a minute. People forget to celebrate. Let that sink in. Okay, so my name is Marcia Gordon. We have two locations, and it's Marcia's Healthcare Registry. We're in Broward and we're in Palm Beach. Feel free to come by and put in an application. We are always hiring CNAs, LPNs, and RN. At this time, we'll have Dr. Karen Lewis, and she'll be doing the part two, as I said. Go ahead, Karen.
Okay. Good afternoon, everyone. So we're here again talking about Alzheimer's. And for those who were here last week, I'll do a little recap as to what Alzheimer's is. So we had said that Alzheimer's is basically the most common form of dementia. Because remember, we have different forms of dementia. We have vascular dementia, we have Lewy body dementia. So Alzheimer's is only one of the forms of dementia. So basically what we said is that the understanding of Alzheimer's is not, even nobody knows what causes it right now. A lot of research has been done. We understand how it happens, but it's a combination of genetic factors, environmental factors that actually leads to health that actually leads to the to one getting dementia. So what we know about dementia is that it's a condition in which the brain is a condition in the brain where there is destruction of memory and thinking skills, and then after a while there's the inability to carry out simple tasks. So it tends to appear later in life, that is 65 and older. Can occur before, but it tends to occur older in life. There are people who get dementia from their 40s and earlier, but it usually occur later in life. So what happens is that there's loss of their functional cognitive function, meaning they lose the ability to remember things, think, reasoning, and behavior. And as a result of that, it interferes with their activities of daily living. So you can have mild dementia, moderate dementia, and severe dementia. We should understand that a little history that Alzheimer's basically was named after this Dr. Alois Alzheimer in 1906.
Interesting.
And that is
Wow.
because he noticed that he had a patient, a woman who died, and it was an unusual mental illness that she died of. And he couldn't understand what happened with her. So when they actually did the biopsy after she died, they examined her brain and found out that there were some abnormal clumps and plaques that were in her brain. And so they coined this disease, Alzheimer's. But she exhibited the memory loss, the language problems, the behavioral disorder. And so, that was, of course, that was how many, a decade, 100 years ago or more.
Yeah.
And so they noticed, and that was one of the first time that the Alzheimer's disease was actually named after this Dr. Alzheimer. Interesting, isn't it?
Right, very. Oh my God.
So, so what we find out is that what scientists have come to find out is that they have there are changes that happen in the brain. Lots of changes. There's abnormal buildup of these proteins and plaques, and as a result of that, you eventually get the healthy neurons that we have in our brain stop functioning, and then the connection between the neurons are lost, and eventually there's shrinking of the brain cells. Remember, as you get older, there's shrinking. So there are two ages. Children brain is smaller because they grow, and older people brain is smaller because it shrink. So it's like having a nut in a shell, and in a young person it is small because it's going to grow and fill up the shell. In older people, it was all full, but when you shake it, you can feel the brain shaking inside there.
Yeah.
This is just illustrative. An
Right.
older
Very
person,
good.
and that is why when an older person falls, we tend to want to do imaging, that's a CT scan or MRI on the brain, because the brain is in the shell and it's smaller, so it can move back and forth when the head hits, and that's why you can have the blood vessels can tear or sharing activities of the blood vessel because of the coup and counter coup motion. In a younger person, that's not the usual event because the brain is more full, but as you get older the brain shrinks, so we call it cerebral atrophy. So yes, so in Alzheimer's, they're losing it. We still have the normal aging pattern, but they still have a lot more shrinking and a lot more loss of neurons, loss of interaction between brain cells, and that's why they have such difficulty doing all of this. So usually the first thing that happens is your memory. They forget things, and remember, all of us forget things from
I
you're
know, right?
born until now.
Yes.
You ever ask a child where to put something? They don't have a clue. And as you get older, you tend to forget things, and so um, as you age, you forget things. So a lot of people are not even thinking that anything is wrong because you're forgetting things, but it's gonna be a little bit more abnormal, you know. And when the symptoms start to interfere with your daily life, you have you're not able to oh my god, did I pay the man? Did I pay the did I pay my bills? Because you can't remember if you paid your bills. Did I pay my bills? Did I you go to the supermarket and you forgot that you bought groceries, but you left them in the car and you don't remember. You don't even remember tomorrow. Probably the next time you remember is when you go into the car and see the groceries and you're like, oh, when did I buy these? You don't remember. You don't remember buying them. And then you have problem, and this is not just memory loss. This is not usual. So it's abnormal for you. It doesn't matter. It's abnormal for you to just it's abnormal for people to go to the grocery and just walk into the house and leave the grocery in the car. It's like you have a baby and you walk into the house and forget that you have a child and you leave that child in the car, you know. So there is decline in memory, and that is why they try to ask us to do, like, people, especially elderly people, to do a lot of these spatial activities, word finding, using their vision to do things. You're trying to jolt their memory to remember things. The games that they play, the not just the puzzles, but the word games, and trying to remember, stimulate the brain as much as possible. And as I said to you, you've got to what we've noticed is that Alzheimer's people who have less than a high school degree or high school certificate are more prone to having dementia. And that is because they're not using their brains as much as other people. And so one of the things to do is to use your brain as much as possible. Stimulate the brain, challenge the brain, do challenging activities. I'm not telling that people who don't do these things won't get Alzheimer's, but you're actually working your brain. Your brain, do you know that we barely use our brain cells? Do you know how much brain cells we never use until we die that go back to the grave with us? We are fearfully and wonderfully made. We have so many brain cells that we barely use on a regular basis. And so we've got to stimulate those brains. The computers have nothing on us, nothing on what God made. They're simulating our brains. They have nothing on us. So we've got to use our brains as much as possible. So as I said to you, it starts out with mild Alzheimer's, where basically you find these people wandering. They're lost. They don't remember the directions to get back home. They have problems handling money or even paying their bills. They're repeating questions. They ask you the same thing over and
True.
over and over and over and over.
Mm-hmm.
They're talking about this, and then 2 minutes later they say the same thing, or they ask you the same thing. And these people have problems completing daily tasks. They're trying to fold the clothes, and they take the whole day to fold the clothes. They fold it, they unfold it, they fold it, they unfold it, and they can't finish folding the whole clothes.
Mm-hmm.
So they're having problems completing just
Yes.
regular normal daily tasks. And then the other thing is that you can have some personality and behavioral changes.
Mm-hmm.
um in moderate Alzheimer's, these tend to be a little bit worse. So basically, um the brain, now there are damages to the areas in the brain, so you're basically having problems with language, controlling their language, reasoning, um, their processing their memory, sensory memory, such as ability to detect sounds. They have difficulty detecting sounds. Even the sense of smell goes, and their memory loss and confusion becomes worse. And to this point, when they get moderate dementia, they have a problem remembering even their friends and family members. These persons, when they reach to that stage, they are unable to learn new tasks, and that is why when you take them out of their environment
Mm-hmm.
and put them in another environment, there's always problems. They
Mm-hmm.
fall, they get
Mm-hmm.
confused, they get
Mm-hmm.
agitated, because they're already used to their environment, and now you're taking them out to learn a new environment. They already have memory issues and can't remember where the bathroom is, but you put them in a
Right?
place where they don't even know where the bathroom is. They're not going to
Mm-hmm.
remember, and they're going to be always having difficulties. They're at risk for falling,
Mm-hmm.
they're at risk for just agitation, they're at risk for getting lost, wandering around, and just being totally lost. And then remember, to this point, they start hearing things. They have the hallucinations. They're seeing things, they're
Mm-hmm.
hearing things, they get paranoid. You stole their money, you stole the
Jewelry.
clothes, you
Mm-hmm.
stole the jewelry, you stole everything. They put it down and hide it in the bottom of the bag,
Mm-hmm.
and they don't see it on the dresser because that's where it normally is. And you came in there, and it's you take it. Or they hide it under the pillow, and they don't normally see it where it
Don't
normally is.
remember.
And they would take Jesus off the cross
Mm-hmm. True.
because you're the one who took it. And that's because of their paranoia. They're paranoid about everything. Anything that you give to them, you're going to kill them. You're going to do different things to
Mm-hmm.
them. They tend to have delusions, and they hear things.
Yeah.
They do hear things. They see water in the house, on the floor. They see water. They see
Wow.
things on the floor. They see people in the house. They see things. Somebody pass, and they say, call you and said, you know, I saw John passing out there. Poor
Mm-hmm.
John. John was never in the house. John is probably in another country,
I
but they
know, right?
saw John,
Oh,
and they're
God.
sure that they saw John.
So sad.
That is when it becomes moderate.
Mm-hmm.
And a lot of these times, these people are going to be needing medical intervention. And then you have the case where it becomes really bad, and then you have severe dementia.
Mm-hmm.
And this is when basically the plaques tangles in the brain, and then as a
Mm-hmm.
result of that, the brain shrink significantly.
Wow.
And these people now are able to, they're unable to communicate,
Mm-hmm.
and thus are completely dependent on others for their daily care. And it gets to the point where they basically just stay in bed. And once they start to stay in bed, no, you start to get concerned because it's the end of life. And then eventually the body shuts down. So it's just that it's a long, debilitating condition. People have diabetes and live a normal life forever because the complications are, once you control your condition, you can live a normal life forever as long as you control your diabetes or your high blood pressure, or those patients who have COPD. But in this case, even though you're given medications, there's not much control that you have. You can slow down the progression of the illness, but the illness is something that progresses. It does progress. It could take years, but it does progress. And the sequelae of it is that, unfortunately, it goes to severe dementia, and then it's an end of life illness. So, it's sad because it's not an easy thing when you're watching a loved one just deteriorate. I mean, it's not gonna happen like tomorrow. It's happening tomorrow. It's years. It's years of deteriorating. You see them getting confused, and another probably 5 years if they live to 5 years or whatever it is. You see the progression, the memory loss, the decline. That you have to get somebody to be with them because they can't dress themselves. They put on the clothes and they probably take on your clothes and put it on thinking it's theirs. They're unable to cook, so they're unable to care for themselves that way. They don't bathe, they fight. Somebody's always going to hurt them, so you have to make sure, and especially when they have the behavioral aspect of it, they will fight. They will spit on you. They will say all manner of harsh words. And so the caregivers have to understand that it's a part of their illness. And if it gets that bad, their medication that they can take. You're between a rock and a hard place. Do you want this person to be at risk of hurting themselves, or do you want them to stay calm? The medications, as I say, have their side effects. But what are the benefits? What are you trying to attain? And that's where the problem come in, because you're trying to see if you can try to get them as safe as possible, calm them down so that they don't have these outbursts and try to run away, try the elopement. And then, but as a result of that, the medication in itself declines the patient. So it's sometimes, it's a decision you'll have to make, and that's why you have family members making that decision. And at least the happy thing is that when these patients have family members who can be involved in their care, at least they know that there's somebody who care about them, who love them. But what about those people who are alone, never had children, never had spouses, who don't have anybody to advocate for them that way? That's a sad part. So it is sad when you have family, but there are people who don't have family to advocate for them, and then that's where that happens. That's where it becomes horrible. But we said that, remember that we're talking about the risk factors associated with Alzheimer's, and we said that apart from genes and environmental factors, there are other conditions, like other medical conditions like disease, heart disease, stroke, high blood pressure, diabetes. These are all factors. Drinking alcohol, smoking, these are all factors that are involved in increasing the risk factor for Alzheimer's. So if we can control our other medical illnesses, other common medical illnesses, then we can control Alzheimer's to an extent. You might not be able to stop it down completely, but at least you can ward it off as long as possible by controlling. And your diet is important. And remember, we spoke about exercise. Do not stop moving. Move. physical exercise, social activity, man. That's one of the things. We're social beings. We
Mm-hmm.
were made to interact with other people. We were not made to live by ourselves.
True.
And that actually does worsen the whole Alzheimer.
Yeah.
People who live by themselves, people who live alone, older people, they've grown their children,
Mm-hmm.
their husband has died, and as I said to you, most of it is women, and the reason why they think it's women is because women live longer than men, so their partners have died and they're by
Mm-hmm.
themselves. And the society now has changed where there's a lot of migration, so people are not around their family members as much. Remember a long time ago,
True.
as
Mm-hmm.
in the early days, you had your children, and who would go to children? The grandparents. The
Yes.
parents go to
Mm-hmm.
work, and you drop off the child at the grandmother's house, especially now that it's summer, and she would have that child, oh my lord, doing
Mm-hmm.
everything. Grandma, you need to
Reflective.
read this. Grandma, you need to
True.
turn on the computer. Come and
Mm-hmm.
watch this. Come and do that. They run outside. Can you catch the ball?
True.
Can you kick this ball with me? And can I need that apple? Can you pick that orange for me?
True.
And that child, you have that child, have you not just moving,
Mm-hmm.
but have you learning new skills, because in order for you to interact with them, they're going to go on the phone, and they're going to tell you, you say, what are you doing, and they start to show you, typing on the phone and finding new YouTube
Mm-hmm.
videos, and they say,
Yeah.
grandma, watch this with me, and
True.
you're watching and laughing with them. Or they might want to watch TV and you don't know how to find the channel, and they say,
Mm-hmm.
press this one, press that one, go
True.
to Netflix, go to YouTube, go
So
to
true.
wherever you want to go to. And then you're learning these activities, using your brain to find them, not to
Mm-hmm.
mention things that they're doing. Your parent might leave work for them to do, and you might say, okay, come, let's do your work, and they say, grandma, I don't know how to do this, can you help me? And
Amen.
you're at it with them, and they say you're doing multiplication and addition, and you start to
Mm-hmm.
say, let me see if it's correct, and you're checking it, you're using your brain, you're challenging yourself, you're using, you're learning new things, you're challenging. That doesn't happen anymore. So the older people don't have the stimulation of the younger kids that would drag them all over the whole place. You have to make sure you're be able to catch a ball. You know, who are you catching a ball with? Who are you kicking a ball with? Who are you running from here to there with? Who are you parting fights with, especially if you have more than one children there?
Mm-hmm.
And then the other thing is that you have to care for them, so you'll have to put on the clothes, learn to put on the clothes, fix one
True.
hand in the other hand, put down. Sometimes if they're the younger ones, we might have to take off the pull-ups and put them by
Mm-hmm.
the pull-ups. So these are you're active for the entire day that you're with this child. When evening comes and the parents come in, like, oh my god, I can't take them back to board, they kill me, it drove me crazy, but you want them back because
True. True.
the
True.
life that they brought into you,
True.
which you had lost for
Mm-hmm.
so long, is there. So things have changed a lot
Mm-hmm.
now that we're not able to have that kind of interaction with our family. But it is really, 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 really helpful. And
Mm-hmm.
remember, a lot of areas, churches have social activities. There's senior
Mm-hmm.
groups. Don't underestimate them. These senior groups are very important.
True.
Very
Yes.
important.
So true.
They're able
Yeah.
to, a lot of times, they're able to talk about what's happening with them,
Mm-hmm.
talk to somebody else who they think might be able to understand what's
True.
happening to them, get the encouragement that they need from these, because they might not want to talk to you
That's
because
true.
you're young, but they will talk to another 80-year-old
True.
lady.
Mm-hmm.
The boy, my arthritis, and she said, yes, you know what? My
Mm-hmm.
daughter, I went to my friend and they told me to use some turmeric, and I've been rubbing it. I've been drinking turmeric, and I've been rubbing it with this rub, and it's working for me. And you try it and that kind of thing. So, you said, boy, I can't. I can't. I've been having problem with memory. They say, man, might have a friend who gave me some bushes, and since I started to drink it, it work.
Mm-hmm.
I mean, I don't know what it is, but they'll be telling you some things, and it helps you. It helps you
True,
to
true,
talk.
true.
It's just like women who are going through menopause. You talk to a
Mm-hmm.
younger person, they have a clue or what to tell you. You talk to somebody else who is sharing the same illness, like you said. You know, evening primrose, I've been using this and it helps me, or I've been doing this and it helps me, I've been doing that and it helps me. So there are a
Wow.
number of things that we do. But remember, once you have an older relative who has you think they're having Alzheimer's, get to a doctor.
Mm-hmm.
Ask your doctor, talk to your doctor, tell them what's happening, and they'll be able to advise you. They'll be able to um, point you in the right direction. Sometimes they need
Mm-hmm.
medication, they need labs, they need other things. Remember, not everything that looks like an orange is an orange, okay? So it might look like it's Alzheimer's, but it's not necessarily Alzheimer's. So don't label your person's Alzheimer's.
True.
You go to your physician, let them get you checked out, because there are a number of conditions that could give you behavioral issues that you think is Alzheimer's and is not necessarily Alzheimer's. Okay. Um,
Mm-hmm. What are Karen?
mhm.
What are some of the foods that we can probably eat? And like, are there like special vitamins that we need to take? Probably that could kind of help us as we
As we age.
age.
So the thing about it is that usually we should get enough food,
Mm-hmm.
vitamins from our diet. We
Mm-hmm.
should. However, what we realize is that um, uh, we may not get the vitamins that we possibly need,
Mm-hmm.
because we're probably not eating. But if we eat a balanced diet with fruits and vegetables, and we're actually getting daily sunlight, we should be fine. But some of the things that we need to repair ourselves. So we need stuff that we need to repair ourselves. So we need our vitamin D. Vitamin D is very important. So we need our vitamin D. So I mean, you go to your doctor, you can check your vitamin D levels. If they say it's low, you can make sure you take your daily supplements of vitamin. You need your vitamin Bs. You need your vitamin, your trace minerals, your zinc, your manganese, your magnesium. These are trace minerals that you take on a daily basis. And remember, your vitamins. You have your vitamins that you take for your vitamin A, your vitamin E. These are from your pawpaw, your carrots, your pumpkins. These are from your nice orange, yellow vegetable fruits. So if you eat a daily balance, but remember with the problem with older people,
Yeah,
the appetite is not
true.
there. There are two ages. In kids, in children, the taste buds are not developed, and so things don't you have they eat bland food, and the same thing in
Mm-hmm.
older people. And that is why it is so important, because the taste is not there anymore, so they
Yeah,
eat with their eyes. You have to make the food attractive. They eat with their
that's
eyes,
it.
they eat with what they see. Even if it don't taste good and it look good, they will eat it.
True.
You understand?
Mm-hmm.
The food could taste so good. Somebody says taking my magnesium right now. The food could taste absolutely good, but
Mm-hmm.
it don't look good. They're not eating it because their taste buds have lost its function. Remember, the sensory functions are not there. They lose the ability to smell and taste and hear
Mm-hmm.
and also detect things. So it's going to it's going to interfere with them, so they probably are going to benefit from getting like a daily multivitamin, because they're just not eating what they're supposed to be eating. So it's a matter of, but there are a number of supplements that they have to, even oral supplements that tend to have
Mm-hmm.
are fortified with vitamins for them to eat. But they have to just, it's a matter of just trying to get a eat a healthy diet, and you have to start from early. Do not wait until then. From day one, you're to make sure you take your your daily your make sure you have a daily intake of a healthy diet from day one. Nutrition is very important. Nutrition is very important.
True.
Green leafy vegetables, in fact, we go back to eating, and we go back to where we're supposed to be eating. We're supposed to be eating our fruits and our vegetables. And if we continue on that path, we should have healthy brains, not clogging up the brains with a lot of things. And then the exercise. Remember the exercise, you produce all these natural endorphins. Oh my God. Have you ever exercised when you finish, you just sweat out
Yes.
all the impurities, and when you get a shower, you feel like
Yes.
you can take on the whole world? Yeah,
Mhm.
exercise does that for you. It allows your body to move. Everywhere you have a joint, and you have to move that joint, or else it's gonna seize up. You know,
True.
you put down something for a while, it can't move. You've got to move. If anybody who has had um, a fracture, and they are in a cast, and they
Mhm.
never move the leg or move the arm, when they're ready to move it again, it's problems. That's why you have to do the physiotherapy,
Right.
because after you move it for a little while, every time you move it hurts until you get back on
Mhm.
track, and then it stops hurting for a while. And it's not just the hurt of the fractures, the hurt of the limb not moving at all, because we're made
Mhm.
to move. We are made to move. We are made to eat the way we're supposed to eat. We're able to eat a healthy diet. We're able to move. So I remember in older people, they don't. They've lost a lot of their senses. And so a lot of their diet is basically, you, we're told, older people eat with their eyes. They eat
Yeah.
how attractive the food is.
It looks,
If
yeah,
it,
my
if it
grandmother would
doesn't
say
look
that.
good, they're
Mhm.
not. It doesn't matter how it is. You drop that mashed potato and just put it down like a slab,
Mhm.
and you put down a piece of
Mhm.
chicken, and you throw some vegetable there, and it looks disorganized and yucky.
Yeah.
Don't expect
Okay.
them to eat it, but you put a
True.
little bit, and
Mhm.
you decorate it, and you put this,
Presentation.
and you put it nice and everything, and you
Mhm.
decorate the table, and you set it properly. Oh my gosh! When they come to the table and see that, they feel like kings and queen, and they just
So
ready to start eating. So it's just what it is. It's just what it is. We just have to make sure that even with these people, we have to take care of them. And remember, caregivers need care too.
true.
Caregivers need care too.
True, true,
Thank you
true.
so much for
Wow.
listening. I hope you enjoyed.
Thank you
Um,
so much, Karen, Dr. Karen Lewis. Oh my God, that was great information, and we thank you so much. And if you have any questions, you can put them in the chat. She can answer them at a later date.
yes.
Thank you so much, Karen, for stopping by with us today.
Okay, great.
And we also want to thank everybody for listening to our life today. And remember, the key to a healthy life is having a healthy mind. Also, if you have loved ones that need an aid, we have qualified aides that are certified in Alzheimer's. You can reach out to us. We can have someone to take care of your family members. So just remember that you can always reach out to us. Thanks again, Karen. Great information. And thanks everyone for joining our lives today. And remember to like us on Facebook, IG, and YouTube. And we're
Okay,
always
bye.
here to help the community. Bye bye. Thanks again. All right. Thanks everyone for joining our live today. And we'll see you guys next week. Same time, same place. Have an awesome day. Blessings.